Sitoheto, caregiver of Sasin Iloilo Batch 3, and today I will be performing return demonstration about perineal care, which means cleaning or bathing the genitalia or surrounding area. Purpose of perineal care is to keep cleanliness and prevent from infection, to make him or her comfortable, gather all required equipments, organization, and facilitate accurate performance, explain the procedure to the client, providing information, fosters cooperation, perform hand hygiene to protect and to prevent infection, proper positioning prevents back strain. This procedure is important for us to remove normal perineal secretions and others, also to provide clients comfort and to prevent infection or contamination from the rectum. So, first, we need to prepare all the materials for us to save time and effort. So, the materials that we are going to use are gloves, bed blanket, rubber sheets, bedpan, warm water, sterile warm water, 7 pieces dry cotton balls, soak in a cleansing solution, extra cotton balls for the buttocks, kidney basin, pick-up forceps, and antiseptic spray. So, completeness organization for our equipment ensures our efficiency. We can now proceed to performing hand washing for us to determine the spread for microorganisms. We need to introduce myself and verify the client's identity using agency protocol. Explain the treatment to the patient and why it's necessary for us to let the patient understand the process and can improve patient's cooperation. Okay, good day, ma'am. I'm Jovi Satoheto, your caregiver for today. So before we start, may I see your wristband, please? Can you please tell me your full name, ma'am? Your birthday? And how are you today, ma'am? Okay. So I really hope that day will end up a good one. So today, ma'am, we will having an assessment called perineal care or perineal flushing. So I just wanted to know or to be informed that in this assessment, your genital area will be exposed. Would that be okay?
Okay.
So, ma'am, upon exposure, of course, I will be cleaning your genital area from any vaginal discharge for us to prevent any contamination or infection. So, after we need to screen the patient, we need to lock the door, fix the curtains to provide patient's privacy. So, I will wear my gloves, of course, to prevent infection. So, next, I will be covering her body with a bath towel. And of course, place the rubber sheets and the bedpan under the patient's buttocks to prevent bed becoming soiled. So, I will be exposing your genital area, ma'am. Okay?
Okay.
So, after this, we need to inspect the perineum and note areas inflammation, swelling excessive. So, discharge or secretion from the orifice and presence of odor. So, upon my inspection, I do not smell any presence of odor, and there are no any abnormalities, which is good. And now we can proceed. And after that, we need to flush the perineal area with warm water. So I will be pouring this warm water to your private area, ma'am. Okay. How do you feel, ma'am?
I'm good.
So now we need to get cotton balls soaked in a cleansing solution using pickup forceps to maintain sterility.
Go.
So let's start from the midline of the symphysis pubis down to the anus, then discard. After with the second cotton ball, we need to clean starting from the mons pubis and figure of 7 by a way of internal labium towards the anus and then discard after. So next with the second cotton ball, again with the use of figure of 7, start from the mons pubis. This is called lower lip or smaller lip down to the labia minora to the anus. Again, figure of 7 down to the anus. Then discard. Of course, secretions that tend to collect around the area minora bacteria grow to do likewise on the opposite side. Using the next cotton ball, again figure of 7 from mons pubis down to the labia minora, then to the anus. Figure of 7. Then discard. So with the fourth cotton cleanse, starting from the mons pubis and figure of 7 by way of external labium towards the anus, then discard after. So just recap again, the word labia majora is also defined as the larger lips of the external part. Again, from the mons pubis, external part pubis, figure of 7, then down to the labia majora to the anus, then discard. And get another one of this is the fifth cotton ball, so do likewise on the opposite side using the next cotton ball. Again, figure of 7, mons pubis, figure of 7 down to the labia majora to the anus. Then discard. Now we are in our sixth cotton with another cotton ball or the sixth cotton ball. Now we will be cleaning the groin. In the cleaning the groin, we need to start from the groin going up the thigh using the zigzag pattern will help us to prevent you tracing a stroke. So note or clean the area furthest from you. So I will be cleaning the right part of the patient starting from the groin, then to the thigh of the patient using zigzag pattern. Then discard. Zigzag, of course, you can also use another side of the same cotton that I have applied. But for us to avoid any possible contamination, we can use the 7 cotton ball that we soak in a cleansing solution. Again, we will be using the 7th cotton ball for the left groin. Again, zigzag pattern will help us to prevent any retracing of stroke that can contaminate the area. And then discard. Now, after we need to flush the perineal thoroughly with the sterile warm water to reduce the possible transmission of microorganisms. Using again the 7 dry cotton balls that I have mentioned a while ago, we need to dry the perineum of applying the sequence of stroke, just like what I have done a while ago. So drying is important because moisture supports the growth of many microorganisms. So again, start from the midline of the symphysis pubis to the anus. Then discard. Then dry cotton ball, mons pubis, figure of 7, then labia minora to the anus. Figure of 7 to the anus, then discard. Then, in the opposite side, figure of 7 again to the anus. Then, the external labium is mons pubis, figure of 7. Then, labia majora to the anus. Then, discard. So, now let's proceed in the groin of the patient. So, zigzag pattern to the thigh, then at the opposite side. So, if necessary, you also need to spray with the antiseptic as needed to promote healing. Wait lang. So, I will be spraying the antiseptic spray now, ma'am. So, now, we need to put the perineal pad with an up-down motion as needed to prevent contamination of vaginal and urethra from the anal area. Okay, ma'am? This wet blanket will discard to the medical hamper. Are you comfortable, ma'am? So, this assessment will done. Again, Jovi Setoheto, and thank you for your cooperation. So, we need to do aftercare of the materials. Use, remove, and discard gloves, and perform hand hygiene again to prevent the spread of microorganisms. Okay, so for my documentation, I will document the date and time and procedure of the perineal care.